So all the cervical motions are usually done actively, not passively. And if you have any questions about that, they're actually, there's a DVD at the back of your book that has those. And then one other active one that we're going to do is pelvic tilts, okay? And this is actually preview of next week because it's a bedside exercise, okay? So what I'm going to have you do is I'm going to have you bend your knees, and I'm going to put my hand underneath the lumbar, his lumbar lordosis, okay? And what I want you to do is I want you to push your belly button into my hand. Okay, can everybody see what his pelvis is doing?
Posterior tilt.
Posterior tilt. Okay, now I want you to move your hand, your back away from my hand.
Like lift myself? Or
No, just move it away. There you go, arch your back. Okay, so sometimes you have to vary what you say because some things work for some people and others don't. Okay, so again, push into my hand, and now move as far away from my hand as you can, arching your back. Or I can say, push your belly into my hand, push your navel into my hand, and sometimes that will help. Okay, so that would be an anterior tilt. Can you all see that? Okay, all right, so the next one we're going to do is is a pelvic tilt that's passive. Okay, so this could be a passive or an active assistive, and it's kind of a nice mass flexion of the hip, actually, flexion of the hip and knee, as well as a posterior tilt of the pelvis. Okay, so I'm going to need you to move close to me. Okay, don't fall off. And I'm going to lower the mat a little. Okay, so my hands are underneath his flexed knees. Okay, can everybody see that? And my other hand is on the mat. Okay, and I want my hand sort of like an anchor or an axis. Okay, because what I'm going to do is I'm going to shift my weight from the leg that's closest to his knees to the one that's closest to his shoulders. Okay, I'll come over there and do it in a minute. Okay, so up and back. Oh, let me do all the work. Okay, so you can see it's got a nice posterior tilt, kind of a little nice mold for the back. Okay, there's a little bit of rounding. And English patients like that. Okay, I'm going to come over this side so you can see my lovely behind. Okay. All right. So again, my hand is here. And it's here. And bring it up. And back. So this is hip flexion, knee flexion, and posterior pelvic tilt. How'd that feel?
It's good.
Good?
Yeah.
Okay. All right. So the next one we're going to do is lumbar rotation. Yes, question?
The one that you just did, did you say that was the flexion with the posterior tilt?
Yeah.
And then the other one was anterior tilt even when he pulled away and pushed down.
Well, no, anterior tilt when he pulls away.
Yeah.
Posterior tilt when he pushes down. So that's an active one.
It's the one that's here.
Yeah. And this should just be
This one
passive.
is
Okay.
Yeah. Oh, I forgot to tell you what I was doing passive. Forgot. My fault. Could you see that we could do this as an active assistive one too? Mm-hmm. Okay, what would I do? How was it difficult?
Bring your knees to his chest.
Yeah. I want you to bring your knees to your chest and do as much as you can, and I will help you. Okay, looks the same practically. It's just that he's doing more of the work than I am. Or he's doing some work where I was doing it all before. Okay, so the next one is called lumbar rotation, and it's a really nice position for a patient, especially that has been laying down and just kind of in one position. So this is kind of like scapular moves, but one step below scapular moves, okay? But again, real important that I use good body mechanics because he's heavy. Okay, so for this one, I'm going to need you. Can I move your?
Yeah, sure.
Okay. Give these here. So I'm going to cross your arms. Okay, so I'm going to put my hand on his shoulder. Okay, so my left hand's going on his shoulder, and my right hand is leaning across him. Okay, and he's at the edge of the mat, and my body is right into his body. Okay, so my stomach is right into his pelvis. Okay, because I don't want him falling off, and I want to use my body to keep him on the mat, but I also want to be able to rotate him. Okay, so again, my forward leg is towards his shoulders, and my backward leg is towards his knees. Okay, I'm reaching across, and I just sit down and come on up. So I use my body to get him back up. So I reach across, and then I can use my body to pull him up. How's that feel?
It's good.
Do it again?
Sure.
Okay. Can I do the other side?
Sure.
Okay. Okay, so hand across, and I come down. So I'm not doing a lot of lifting, I'm just using my body. Okay, so lumbar rotation. The next thing we're going to do is thoracic rotation. So I want to make sure that he's in a nice, his upper body is definitely in a nice ball, especially like John, Mr. 6'10", I need to get him in a nice compact bundle. It's a lot easier to move than his long arms and legs. Okay, so I'm going to have you move close to me. There we go. Yeah, that's good. Okay, so this time my hand is going on his ASIS, and I'm going to be pushing down. Okay, my left leg, the leg closest to his pelvis is forward, and the leg closest to his shoulders is back. Okay, I'm getting my body into his, and then I'm taking my hand and I'm doing extreme wrist flexion. Can you all see that? Okay, and that my hands are straight out. They're in extension. My fingers are in extension. Okay, and so what I'm going to do is I'm going to bring my hand over to the spine of the scapula. So I'm reaching over to the spine of the scapula. This table's a little high for me right now. Okay, so my hand is on his scapula. I'm not grabbing him. I'm not grasping the scapula. My hand is just on it. My body is right into his. And I just sit down. Okay, right into his. And I sit down. How did that feel? You like that one?
Yeah.
Okay, so how about practicing?